Good afternoon and welcome to our broadcast. I am Sarah Vaezi, Chief of Digital and Growth Strategy at Providence, and I sit within the Digital Innovation Group at Providence. As a reminder, the information provided during this event is for information purposes only. For any medical questions, please reach out to your primary care or healthcare professional. Now let's begin. I'm really excited about today's session. I'm joined by Aaron Martin, who's the EVP and Chief Digital Officer at Providence, and he's also Managing General Partner at Providence Ventures. So he has a really interesting vantage point within the organization. And he'll, of course, share a little bit about his background with us, too, which is unique and will definitely tie into today's conversation. Today, we're here to talk about big tech and healthcare. And there's been a lot of really exciting news and, frankly, a bit of manic hype, if you will, around big tech and healthcare lately. So we're going to get into what does it mean for us as health systems? What are we really thinking we're going to do about it? So I know Aaron has a lot to share on this topic. So I'm going to start off by just asking Aaron, can you share a little bit about your background and your role with Providence to set some context for folks?
Yeah, sure. Thanks, Sarah. So, a little bit about my role. So there's three parts to what my team, what our teams do in the Digital Innovation Group at Providence. First is we're the marketing organization. So we are responsible for brand in and outbound marketing. We're also responsible for digital. So anything that the consumer or the patient sees from a digital standpoint, so how they interact with us through apps and content and those types of services. And then the third part is, as you'd mentioned, Providence Ventures. And so the Providence Ventures team makes minority investments in early stage, tech-enabled startups, tech-enabled services companies, medical device companies, things like that. So we've got, it's a $300 million fund, have 26 portfolio companies in it right now. And then Sarah, as you know, because you run this, is we have a digital strategy team, which you lead, that also kind of directs a lot of our incubation operations with our product and engineering team. And so we've incubated and spun out three companies that we founded at Providence and spun out where we saw kind of white space opportunities in the market where we couldn't find an adequate solution out in the market. So that's a little bit about what my team does. My background prior to Providence, I've been at Providence almost 8 years now. Prior to Providence, I worked at Amazon for almost 10 years. And then prior to that, I founded two companies, one in banking and financial services software and the other in manufacturing software. And then prior to that, I was in healthcare. So I've been kind of in and out of healthcare, I guess, over my career.
Awesome. Well, I know that experience and, of course, your kind of position within the organization gives you a lot of sort of interesting context and background for the topic for today. There's been a lot of news lately around big tech companies exiting healthcare. Perhaps started with Haven exiting or getting dismantled. Google Health. We've heard some news about Apple. I'd love for you to share your views on whether you think they're really exiting, and kind of what do you make of all of these announcements and what's happening kind of behind the scenes beyond just the hype of what we're hearing in the news.
Yeah, I can't imagine. Well, first of all, this is like the second wave that I can remember of, big tech getting into healthcare. Folks need to remember that Google and Microsoft, made some early forays into it, especially in the personal health record space. And I think, the folks at Microsoft would say we've never been out of it. I think the more kind of recent entrants are the folks like Amazon and Apple. And all that said, I can't imagine a scenario where they would ignore or not participate in what's, a full fifth of the economy right now. And probably even more importantly, a fifth of the economy that needs, drastic improvements in terms of, our productivity, the digital enablement, and scaling, as we're now seeing right now. I mean, one of the side effects of COVID is it's moved up the crisis that we were anticipating with respect to labor shortages in healthcare. It's moved it up about 5 years. So this has always been a demographic issue that everybody's been very, very aware of. But because of the Great Resignation after, which it especially hit hard in healthcare because there's so many healthcare workers burned out from COVID. A lot of people retired, left the industry, and we're just not hiring enough folks. And so I think, what that calls for is massive improvements in the way that we deliver care, through technology, so that we improve the productivity of how we deliver care and also improve the quality, hopefully. So I can't imagine them backing out of the industry. I think what they're doing is they're kind of reconfiguring how and where they play within healthcare specifically.
So essentially, this is sort of a retrenching, pivoting, whatever you want to call it, but figuring out what's next, as opposed to throwing up our hands and saying we're done, is
Right.
what I'm hearing you say. And these companies are, of course, known for learning and pivoting, and have done so in other industries and sort of segments. I think you wrote a blog recently and you referenced, for instance, the Fire Phone or the auctions platform at Amazon and how it pivoted into fulfillment by Amazon. So fulfilled by Amazon. So definitely, like, they know how to do this. It's not it's not that they get discouraged by failures. As big tech, but we could also think about like retail, and some of these more upstart kind of digital health companies are all looking to disrupt healthcare. That'll bring with it some challenges. What do you think some of the biggest challenges are going to be?
Yeah, I think some of the biggest challenges are frankly, from a health system perspective, is possibly taking the wrong signal to noise here about, okay, well, big tech is quote unquote exiting healthcare, and therefore we can kind of stand down and kind of focus on the more pertinent issues and kind of ignore the digital opportunity, ignore the impact that technology needs to make on our industry to make it more productive and more effective and safer. I think that would be a huge and tragic mistake, because first of all, if you do the math on healthcare, it just doesn't pencil over the next 10 years. We have too many patients coming in with too many complex diseases, not enough people to kind of care for them as an industry. And that's just true. That's gravity. And so if we don't, even without, big tech disruption as a potential threat, or, even small tech disruption as a potential threat, we still face an existential crisis in terms of, how do we deliver care at the same, by improving quality. And don't forget, we've got huge gains in quality that we need to make as well as an industry, compared to, our peers in other countries. But I think it would be a mistake, even without the potential disruptors coming in and disrupting some of these markets. I do think there are going to be very effective organizations, and we're starting to see them, that we're going to disrupt every segment of healthcare. So everything from kind of the PBMs to healthcare providers like ourselves to insurers, et cetera. Some of these will be enabled by big tech, so they'll power it. Some of these will be big tech themselves. And then, some of these will be, startups and medium-sized technology companies. I would say, my bias is that big tech should be a technology provider to the industry incumbents, as well as, tech startups. I think it's really, really hard for complex organizations like, big tech companies to effectively go in and disrupt at scale the complexity of healthcare. Perhaps they can be, successful on the margins, so for instance, in the area of like, the Hems and Hers of the world, the 30 Madison these types of DTC, treating very specific conditions in a limited format through telehealth, those will be successful. And if I was, a CEO of one of those companies, I'd be looking over my shoulder at, folks like Amazon and the like, because that is a part of the industry they really understand, which is, customer acquisition, the conversion funnel, and how to kind of, do relatively simple services, straightforward services at scale, right? Once you get into more kind of complex services like primary care and those types of things, I think, the most effective businesses that will disrupt or change those segments of what we do will probably be, kind of the independent tech-enabled services companies, the startups, those types of folks, because they have much simpler organizations that are kind of purpose built to go do disruption. And they also, frankly, have hired people out of industry who really understand the industry.
Yeah. And they're also, they're sort of laser focused on a specific profitable area as opposed to being really spread thin across the full continuum. So it just dramatically reduces the complexity while also making the economics a lot more favorable. So sounds like a good strategy. You've talked about like we have very fundamental challenges around like the supply demand dynamics, and that given the size of the industry, it's unlikely that big tech or retailers or other digital health companies will slow down. And so if you could, and I know trying to predict the future is just a recipe for being wrong, but if you could just put on your sort of fortune teller hat for a moment, and to the extent that you're comfortable with it, where do you think some of the big players might land in terms of healthcare? And let's start with big tech. So, whatever you're kind of comfortable with thinking about, you already referenced that you really think technology providers should kind of partner with incumbents from an enablement standpoint, but like, where do you think like the Amazon, Microsoft, Google, Apple contingent will end up?
Yeah, I think it's going to be interesting because they all have their strengths and they all have, areas where it's going to be, more or less difficult for them to kind of enter into healthcare and have an impact. I think, by far the organization I've been very kind of impressed with that is, that I think has made some really, really brilliant moves is Microsoft. I think, them buying Nuance was a stroke of genius, because in one kind of acquisition, even though it was, expensive, they got an entire team that is deep into two areas that I think are going to have a huge impact in healthcare. One is AI, and two is, AI as it applies to very complex services-based workflows that is effectively the bread and butter of healthcare. We're a collection of people think of on the provider side as it being kind of providers. We're a collection of very, very complex services businesses. And so, Nuance is integrated, deep into the EMR, and they've got folks that have, forgotten more than I'll ever know about, those workflows and then also how you can kind of automate it. So, super well positioned to kind of leverage, Microsoft's expertise in AI and their kind of market position in terms of, they have a pretty dominant position in terms of being a vendor to most, health systems. So I think that is theirs to lose. I think Amazon is going to focus again on their strengths of what parts of healthcare could really, really scale. And I can't imagine them getting into really particularly complex care delivery. I think Amazon Care will probably compete in the with the Teladocs of the world. And then once you kind of add into what they've done with respect to PillPack, then you've got a very interesting kind of HIMSS like product offering where you're taking kind of very light touch telehealth care, if you can kind of call it that, with the delivery of pharmaceuticals. So I think and I think those businesses are kind of extensions of the pharmaceutical industry at some level. They're just very, very kind of sophisticated ways of, kind of building a channel for pharmaceuticals that has care, very, very kind of simple care, solutions kind of attached to them. So somebody comes in and needs something for hair loss, and they need to see a physician. They do it through telehealth. They get a prescription, and that's as complex as it gets. It's not in the weeds primary care where you're dealing with somebody who's particularly may have several chronic diseases and is a very complex patient. So I can't imagine them getting into that. I think Walmart is going to, if again, they have the advantage of having a huge pharmacy business. Like I think it's the third largest just in terms of number of pharmacies, and they've got the square footage, and they've hired very smart people out of healthcare to kind of go and lead these things. And so the thing I always talk about is even if they just serve their own employee base effectively, that's a huge economic return just to Walmart. They can lower the cost of care. The other thing I like about Walmart is they're just relentless focus on, on delivering value to the consumer. I think if you apply that kind of same approach to, primary care and kind of and the pharmacy side of things, it could really benefit patients over time. So I think I think they'll be very successful in some way in healthcare. Apple is kind of a one that I'm very kind of confused about, mainly because they're just super secretive, obviously, but also it's I think they've got a really, really great opportunity with the watch, the earbuds, basically, the phone, to becoming kind of the remote way that you can kind of access care in a much more holistic manner, by taking, vital signs, et cetera, et cetera. The one challenge they've got is it's a walled garden. It's, not cross-platform. And so, their devices are expensive. And so, getting that to scale is a little bit more challenging. So I think, that would be kind of my, trip around the world, if you will, of the big tech folks. And, none of this is probably, particularly stunning insights. This is all stuff based on things that they've announced publicly and kind of the interpolation of it. So I think they will be successful. But my hope is, and Rod Hochman wrote a piece today about this and is published in Modern Healthcare, talking about how the biggest challenge that I think that he sees, and I agree with him, for big tech is just engaging really closely with providers and health systems like ourselves, or folks that deliver care, and really understanding what the problems are. And I think that's been a unique kind of position for the Digital Innovation Group. Is what I always tell people is, like, we're side by side with our clinicians and our operators kind of at the coal face of the problem. And I think, it's always good from a product standpoint to get close to the problem, really be able to kind of, engage closely with, patients and the providers. But in healthcare, it's just, you can't be successful otherwise. I mean, it's just you have to have a pretty intimate conversation that's ongoing and iterative with physicians, people delivering care, as well as our patients.
Yeah, and another thing that was really interesting, I thought, about Rod's piece in Modern Healthcare was just the importance of certain things like making documentation easier for providers, like really focusing on very direct sources of value for them. And to your point about Microsoft and Nuance, that's one of the key problems that they're working on, is around like the actual documentation, the ease of use within the context of the EMR. And so that's a really interesting point. And you mostly focused on the delivery side of things, but of course the healthcare industry has the sort of financing side of things as well, and the payer side of things. Do you have any thoughts on that side of the house, and whether there will be some convergence on that space? I mean, there's some already occurring, but what do you think on that side?
Yeah, I think there's going to be convergence of several different industries, and from a partnership standpoint. But I can imagine, a convergence between, healthcare and nutrition. So, think groceries. Think, how do people get access to food, right? So dealing with, for instance, food deserts, which cause a lot of problems in the Medicaid population, right? Health and nutrition. I think there's going to be a big convergence with, financial services. I mean, one of the things I've always kind of thought about is, it's kind of crazy that we have these different products, once you kind of hit, your 60s and, going on even further, you're getting into Medicare, you're getting into, where the financial planning you've been doing is has to pay off. You get into life insurance starts to matter, those types of things. And if you think about it, they're all kind of circling the exact same risk pool, kind of that hits you in later in life around your health, those types of things. And as you know, Sarah, we talk about this all the time. The healthcare industry writ large is the number one way people become bankrupt in the United States. And so, and it's because the way that healthcare is financed is not particularly well done. And so I think there's something around, the combination of these kind of risk pools from a, financial planning, insurance, life insurance, and healthcare that's going to we're going to start to see convergence around that. And then there are other industries as well that that will start to kind of overlap. Retail, we're already seeing that. That has to do with access and convenience. All right, so and we've worked closely with Walgreens on our access plans and have cited Providence Express Care clinics within Walgreens just to make it more convenient for the patient. And then the retailers are starting to kind of spread out in terms of more elaborate healthcare offerings within their footprint because because Amazon is rolling in and pulling everything online that can be sold online. One of the last kind of bastions is some of the care delivery has to be done in person. How do you do that? And then finally, I think transportation. Something I've thought about is what would it take if you just took a white sheet of paper to remake the healthcare system? Well, a lot of it would be care coming to the home, and how do you efficiently deliver that? How do you eliminate kind of the tax of the windshield time, of getting a care provider to a home? Some situations totally make sense economically. Some are more challenging in terms of low acuity care. Hospital at home, those types of opportunities. So I think you're going to see a lot of convergence from these different industries. Whereas, before, I always have joked that healthcare is its own country. If we were measured as we're measured in terms of our GDP in the United States healthcare industry, we would be, fifth right behind Germany in terms of the size of, of our industry. And we also speak a different language, and we have different customs and norms and those types of things. And my hope is, to torture the analogy, we start opening the borders a bit, right? Because we need help from other industries.
So that's an interesting lead into my second to last question, which is how might things kind of change? You've talked about opening up the borders, and what's the influence sort of record, for instance, digital health funding, and that we've never seen the likes of before. I mean, and maybe it's not surprising, but the magnitude of it is certainly intriguing. Or all of the M&A activity that's happening in the capital markets. How do you see those influencing or changing some of the trends that we've talked about today?
Yeah, I think it's going to remake healthcare in a whole bunch of different ways. And this is something that I remember from, I've been around a long time, and I've been through kind of three of these, these huge kind of, explosions in healthcare. There was the Internet 1.0, Internet 2.0, and now we're in the healthcare version of, I would say, Internet 1.0. So we're still in the first kind of models of care, which are, pretty primitive, pretty straightforward. Debatable if some of those models are long-term sustainable, just given the economics and pricing, et cetera, et cetera. this feels very similar to kind of Internet 1.0, right? And one of the things that I think occurred in, back in the late 90s was, and again, I'm an alumnus from Amazon, but before I joined in 2005, you know, funding just kind of dried up when the bubble burst, and a lot of the incumbents felt very good about that. They felt a sense of hubris, right? Of like, well, we're safe because this internet thing is going to be a much slower, process than we ever imagined, et cetera, et cetera. What tends to happen in these kind of retracements is the capital gets refactored behind the winners, and then they become even more strong, right? And so you look at some of the incredible companies that kind of came out of that implosion, Amazon, Google, and then you see, these kind of second generation companies that took the basic premise of the internet and turned it into kind of Web 2.0. So you look at, social media, and you look at, so you look at Facebook and folks like that. And then you look at the new, kind of kinetic models that came out of it, like Uber and Lyft and Airbnb, where, the sharing economy. So, I think we're kind of still in 1.0. And there will be a retracement. There always is, where things get a little too frothy. My hope is it's not too disruptive, but I would just warn, my brethren and sistren, if you will, if that's a word, my brothers and sisters in our incumbent industry is to take no solace in that, and to kind of pioneer ahead, because if there's a disruptive model out there, it will happen. It's like gravity, and the capital will start to shore up behind things that seem to be working. The capital markets are very efficient that way.
Yep. And I know we're almost out of time. So the last question I wanted to ask you, but you already sort of answered it, was what should health systems do? What I'm hearing you say is don't get too comfortable, lean in, look for opportunities to partner. Anything else, any other kind of recommendations or advice that you would have for health systems, given that we're maybe ramping down on 1.0 and going to 2.0? What's your advice?
Yeah, I mean, the thing I would say is be thinking about making, despite all the problems that you've got in terms of workforce, issues in terms of, lack of availability, those types of things. That is the signal to double down on technology more generally. Because the problem that this is pointing out is a productivity problem. And the only way to solve these productivity problems are typically, through technological innovation. And the second thing I would say is we have kind of built, the basic foundations, I would say, at Providence around digital. So we've standardized, the consumer-facing front end. So we now have the Providence app. We have the websites on a single website. We have this unified brand. So we've done, we just launched SSO. So we've standardized a lot of that, and then we've also kind of digitized endpoints, right? So that people can, effectively transact with us online. And I would say, and the progress bar is getting pretty far along that. And then the last piece is, once you have a standard, platform, you can transact across, any of the services that you provide digitally. Then you've got to basically keep the patient loyal to you. And that has to do with personalization and convenience. So making sure that, the care that you're delivering is tailored directly to them, right? And the most efficient way of doing that is through various different digital means. And then finally, I would say is once you've got those three big elements, the standard, large platforms, you've got digitized endpoints, and you have the ability to kind of engage patients through personalization and keep them, engaged on your platform between episodes of care. Then the last part of it is you can create new business models that you never thought of before. And that's what really happened between Internet 1.0 and Internet 2.0. The business models in Internet 1.0 were pretty much duplications online of things that were going on offline. 2.0 reimagined it. It reimagined the way that people could connect online through social networks. didn't really exist offline, but it could exist online. The sharing economy really wasn't, practical offline at scale, is practical online. So I would just encourage, like, we're putting in the infrastructure, make sure you're making those investments, you're making progress, but then start doing work around self-disruption, new business models that will improve our productivity and improve the quality of the outcomes that we provide to patients.
Yeah, that's great advice. And I think, we're seeing some activity in the market already around that, the emergence of virtual first health plans from some of the largest incumbents or
Yes.
virtual medical groups. So definitely starting to see these newer, sort of tech enabled models that wouldn't be possible if we didn't have some of that infrastructure in place, kind of taking hold in the market. So that's great advice. Aaron, thank you so much for joining and for sharing your insights today. And thank you to all of you for listening. And to learn more about Providence and our initiatives, programs, services, ways to give, if you're looking for medical care, please visit www.providence.org and make sure to follow us on social media at Providence Health System for LinkedIn, Facebook, and Instagram, and under Providence on Twitter. Thank you all and take care.